Hello guys, and welcome back to my channel. On today's video we're going to be talking about a much needed topic that some of you guys have reached out to me asking for, and that there is not much information out there as for everything hydrocephalus related. So I'm not sure if you've noticed, but like any hydrocephalus topic is seriously underinformed and there is not much information out there. So today we're going to be talking about treatment of hydrocephalus, and just in general it's one of the most important topics with regards to hydrocephalus and with regards to any condition as well. How is it treated? And there is information out there which is very limited, and there is not that much content that is being created around this topic. However, I know that people are searching more and more information online and via the internet, and are also kind of relying on people's personal stories, because I think that's so very important and kind of makes a bond with someone else that has hydrocephalus, that I felt very strongly that I just needed to film this video. And I'm really sorry if I'm out of breath for most of this video, but I'm currently 37 weeks and 3 days pregnant. Basically my planned C-section is in 10 days time. Seriously guys, I cannot believe that next week, oh my god, next week we're going to have a baby. I'm so happy about it, but also really can't believe it. I have an iced decaf coffee here. Grab a drink and let's get started with the topic of treatment of hydrocephalus. So first things first, hydrocephalus basically is a chronic condition. So a chronic condition means that there is no definite treatment for hydrocephalus, like it just cannot go away. Basically the way to treat it is mostly through surgery, and this is how my case was dealt with as well. Very nice. So the most common way to treat hydrocephalus is via a surgical operation and insertion of a VP shunt or a shunt. It might not be ventriculoperitoneal, as in my case. The distal end or the far end may be placed in one of the chamber of the heart or near the kidneys, where the liquid from the brain can be more easily absorbed. But one end of the shunt is always placed in the brain's ventricle, where the pressure is actually building up from the buildup of cerebrospinal fluid. So one end of the shunt is placed in the brain ventricle and the other end is placed in the tummy or inside of the heart chamber or in the kidney. And that is how the liquid from the brain is being flushed out and drained from the body. It's being absorbed from the body and then drained out from the body. And this is the way hydrocephalus is being treated, both in congenital cases or in babies born with hydrocephalus that was developed within the womb, and as well as in children and adults who develop hydrocephalus over time. So this is the way that hydrocephalus is being treated for basically all cases of diagnosed hydrocephalus. And it is a way for the buildup of fluid and pressure on the brain to be managed so that it does not cause any further brain damage. Because basically if hydrocephalus is left untreated, it can cause brain damage and it can be possibly fatal. So this is one of the ways and the most common ways of treating hydrocephalus. Then there is other way, which is called endoscopic third ventriculostomy. Please let me know if I'm saying this word right. I tried, I really did. So it is endoscopic third ventriculostomy, or ETV. And basically I had this done as well before I got my shunt surgery. So before I got my shunt implanted, doctors tried to do ETV or endoscopic third ventriculostomy in order to try and avoid the shunt surgery. Because what basically ETV is your doctor goes into your brain with a very tiny tube, and at the end of the tube there is a camera and a very small surgical instrument, like a very small scalpel. And what they would do is they would pierce a hole inside of your ventricle so that the fluid from the blocked ventricle will drain from the ventricle and onto the surface of the brain, where it can again be drained via the natural body system. Basically this is the way to manage hydrocephalus as well. It is way less invasive than a shunt surgery. With regard to the third ventriculostomy, I had a very positive experience. I had a very fast recovery. I recovered within a couple of days. I did not have that much stitching. I did not have that much downtime, so it is really a less invasive way to manage hydrocephalus. However, in my particular case, it did not work. So it did not work up to the extent that the doctors wanted it to work. So they had to do a shunt surgery as well, which happened a couple of weeks after the ETV. So I had an ETV, I was monitored for a couple of weeks, but when the fluid in my brain did not drain fast enough for the doctors to be okay with it, they decided to move on with the shunt surgery, which is what I got in the end, and which is what is managing my condition, which is what is managing my hydrocephalus. So I need my shunt. I am dependent on my shunt. However, generally ETV has a really high success rate in adults. So basically, there is some research that says that ETV can actually be successful in 70% of adults with hydrocephalus, which is defined by no further treatment is needed, like no shunting is needed or no other surgery is needed after that, after the ETV procedure. However, in my case, it did not work, but it has a really high success rate. So it's definitely an option to discuss with your neurosurgeon if you're currently being diagnosed with hydrocephalus, or there is a discussion of a treatment of hydrocephalus for you or someone you know. This is definitely a treatment option to discuss. When ETV was done, in my case, I also needed to take some diuretics, and this is basically to support your body to expel any kind of excess fluid from the body, including the cerebrospinal fluid. So basically there are two diuretics that are mainly prescribed for this situation, and these are acetazolamide or furosemide. I was prescribed furosemide, and I was taking it for the whole duration of while I was being monitored between my ETV procedure and my shunt surgery. However, those diuretics must definitely be prescribed by a doctor because they can be very aggressive, and there is the possibility always when using diuretics for the body to become dehydrated, which with any condition is not ideal, but when having a chronic condition and while suffering from hydrocephalus or any type of other serious condition can be very, very serious. So with this regard, I wouldn't recommend taking diuretics if your doctor has not prescribed them. However, this was a part of the ETV procedure that I went through. And then with actually treating the condition of hydrocephalus, these are unfortunately the very limited options that modern day medicine can provide. However, sometimes there are some additional treatments needed for support for the symptoms or for support for everyday life to patients with hydrocephalus, and this can sometimes be the case for young children who have hydrocephalus. Just in order for the condition to be more manageable and for young children to have a more successful life and to have a more successful rate of recovery. So these can include any type of, occupational therapy, probably some developmental therapy, which can help with teaching of age-appropriate developmental behaviors, and just in my opinion, one of the most important roles in treating hydrocephalus and the aftermath of hydrocephalus and the psychological consequences of hydrocephalus and of all of the surgeries, procedures and assessments that people go through is mental health therapy. I am a huge advocate of mental health therapy. I have been reaping the advantages of mental health therapy for years now, and I definitely believe that this is one of the most important pillars of treating and managing successfully any type of chronic condition, and with such a chronic condition which is demanding on a person's self-esteem, on a person's way of life, on a person's energy levels, on a person's budget in terms of medical procedures and all of that. Mental health support is definitely something that is of huge help. There are many questions of when will a pharmaceutical treatment for hydrocephalus be available. I know that there are some trials that are being done for pharmaceutical treatment of hydrocephalus. However, currently there is no medicine that can be prescribed for the treatment of hydrocephalus, and the management of hydrocephalus is strictly surgical because both shunt surgery and EVT are basically surgical operations. Regardless of how less invasive EVT is, both of them are considered surgical methods. So currently there is no pharmaceutical treatment for hydrocephalus. However, I definitely know and believe that the whole hydrocephalus community is very much looking forward to the discovery of a drug that we can take and, you know, forget about surgeries, forget about going into long periods of recovery and all of that. And I would be very happy if a pharmaceutical treatment is kind of discovered within the next 5-6 years, because I might need a revision to my shunt system within the next 5-6 years, which I would definitely very much like to avoid if possible. So if there is any pharmaceutical treatment that can mean that, you know, I can take a pill and not need to have my shunt replaced, that would be just fantastic. But now this is still in the realm of wishful thinking. Also, in some cases, hydrocephalus might be monitored for a bit before any type of treatment is being allocated, and that is just because your neurosurgeon would like to assess how your condition is behaving, how fast it is advancing, if it is placing any implications on your everyday life. So even though it is not likely that a diagnosed hydrocephalus will go away by itself if left untreated, there might be a period of time when it is just being monitored so that your neurosurgeon can inspect how your condition is behaving in order to prescribe the best way of treating it. So guys, with that being said, this is going to end today's video. Thank you very much for joining. For those of you who are new here, welcome. My name is Dani, and I'm filming videos on living with a chronic condition called hydrocephalus, just like this one that you watch now. Please let me know in the comment section below if you have had any type of treatment prescribed for hydrocephalus, or if you are currently undergoing an assessment period or any type of treatment. If you find this video useful, please do not forget to hit the like button and to subscribe to my channel, and I'll see you in the next one. Bye guys.